Y-R-E-D, play with me, I put a pothole in your teeth.
Code 3, we have a car crash victim on Interstate 58. It appears the victim has suffered multiple lacerations from the accident and has a piece of metal lodged into her chest, preventing respiration. We were able to stabilize the patient, and the patient received oxygen and fluids, and pressure bandages were placed on the patient's chest.
Upon arriving at the trauma department, it is observed that the patient has shallow, thready breathing, is unconscious, and still has metal lodged in her chest and left thigh.
I will administer epinephrine for the patient and remove the bandages. We must immediately take this patient to the operating room in order to extract the metal pieces from the patient's thigh and chest. Great work, team. The patient can be placed in the ICU, where they will receive a blood transfusion. Now that all my patients have been taken care of, let me give you a quick tour of our facility. Welcome to Stockdale Health Regional Hospital, a cutting-edge facility dedicated to providing fast and effective care for all your emergency needs. At the registration, patients are entered into the system and important details are accounted for in order to ensure appropriate care for the patient. The waiting room features a large seating area, including a television and bookshelf to ensure comfort and accommodation of visitors. The trauma department is specialized to handle life-threatening injuries and conditions. This section of the hospital carries defibrillators, ventilators, monitoring devices, and all equipment necessary to handle multiple life-threatening instances at once. The triage serves the purpose of categorizing patients based on how severe or life-threatening their condition is. When patients arrive, they are directed to our head triage nurse, who assesses the level of severity of their condition. The intensive care unit additionally features a wide range of equipment necessary to treat life-threatening conditions and help monitor and stabilize patients in critical condition. We have multiple life support machines and monitoring equipment such as cardiac monitors, respiratory monitors, and surgical equipment. Complete with the surgical table, instrument table, anesthesia equipment, and monitoring equipment, our operating room allows us physicians to finish medical operations safely and effectively. Our recovery room is proximal to the operating room, which allows for close monitoring of patients post-operations. The radiology department includes a multitude of imaging equipment, including X-rays, CT scanners, and MRI machines. Specialized radiologists and technologists operate and analyze the imaging machines in order to provide reports and help diagnose conditions. In lab and diagnostics, we have a multitude of testing equipment to quickly provide results for the physicians in minutes. This includes, but is not limited to, blood work, culture labs, and toxicology. Our storage rooms feature all medical supplies and equipment that is necessary for the safety of our patients. Whether it's bandages and dressings, medications, or sterilization equipment, the storage room has a multitude of supplies. In addition, this area features a dressing room where staff can place personal belongings and access PPE. Adjacent to this room is a specialized storage area. Here is an overview of the first floor of the hospital, which features all aspects of the emergency department. Our registration is placed near the triage in order to quickly determine the triage level of patients upon their arrival to the hospital. The waiting room is adjacent to registration and the triage in order to ensure easy accessibility for patients and nurses. The ambulance bay is located near the trauma in order for efficient, direct transport of severe patients. The operating room and recovery room are proximal for easy transition of patients. The ICU is near the trauma and operating room for close monitoring of vitals as patients navigate these areas. The second floor features regular patient rooms along with several other amenities of the hospital. Oh look, another patient is entering the hospital. Lori Cole, a 31-year-old female, came in with her chief complaint being her elevated heart rate, exhaustion, and heart palpitations. In the triage, it was assessed that she had a high fever, high blood pressure, and rapid heart rate. After a complete panel of testing, we discovered that Lori was having a thyroid storm due to an undiagnosed case of hyperthyroidism. Because of this condition, anti-thyroid drugs were given to Lori in order to block the synthesis of the thyroid hormone. In addition, plasmapheresis was conducted in order to remove thyroid hormones from the blood. Lori had to stay in the ICU for 3 days in order to fully recover from the thyroid storm. Factors that increase wait time in the ER. Some factors that increase wait time are high patient demand, lack of medical professionals to provide care, and duration of lab diagnostics and results. However, our emergency department avoids these issues by having a patient-to-physician ratio of 4:1, having plenty of physicians and specialists at hand, and by having state-of-the-art diagnostic equipment that gives results in minutes. One aspect of our hospital that sets us apart is our unique patient database system. Each room has a quick smart scanner setup that scans and utilizes AI to translate patient notes into a hospital-wide database. The scanner works by placing the patient notes into the scanner, which will then upload as a scanned document into the database and be attached to that patient's profile. Then, it will utilize AI to translate the handwritten notes into a text document. Both our patients were entered into the system upon their arrival, which allowed staff to track the status of their conditions and treatments. To address understaffing, one helpful tool is a voice charting option for staff. This would save staff many hours of inputting data by allowing them to simply utilize a voice recognition software to input this data. Another method we use to battle understaffing is task organization. Through our software, tasks can be categorized into different triage levels. This allows staff to address the top prioritized tasks primarily. Specific tasks can be allocated to 1 to 2 staff to each to ensure a smooth flow. Come to Stockdale Health Regional Hospital, where we not only care for your health, but care for your community.